Hello, everyone. Uh, nice to see everyone here today. Here is University of Wisconsin Madison. I am Weifeng. I am the microsurgery teacher. Today we have a special guest student, Ipek. Yeah,
Ipek.
Ipek. Yeah, Ipek. She's 5 year mid fifth grade, or fifth grade, or fourth grade medical student in from Turkey. Yeah, and she's visiting us to now she's shadowing craniofacial surgeon, Dr. Galen. Yeah, and yeah, tell our friends a little bit about you.
Hello everyone. Just Dr. Zhang said, I'm a fourth year medical student from Turkey. My name is Ipek Gokceer, and today we will practice with Dr. Zhang how to make microsurgical stitches. I came here for a special, actually craniofacial surgery, but I also want to have chance to practice with Dr. Zhang. That's all.
Yeah. Yeah. Actually, today is the second time. The week before last week or last week.
2 weeks ago.
2 weeks ago. Yeah, we have a group of mini course for the student, undergrad and medical school student, and then Ipek want to practice more. So yeah, so today we will go over some knowledge from last time, and then we see how far we can go. We will practice how to doing stitching, how to handling the suture more efficient, and then see if we how far we can go into our. Okay. Yeah. So firstly, we talk about the microscope first. Microscope here. Now the microscope, this is microscope is a little bit old, but the major component is the same. So firstly is the eyepiece, and then objective lens, and then the objective lens, and then the foot control. Yeah. So here, here is the most of the people will know this one is the interpupil distance. So my interpupil distance is about 68 like that, and then every time I just go there. If like you don't know what's the interpupil distance, we can just from the small and then go to the bigger, or from the bigger go to small. The right interpupil distance allow both of our eye can see one field.
Just one circle.
Yeah, one circle. Yeah. So here's the interpupil distance. And the second thing about the lens is right here. Remember last time we used our 3D plane microscope? They also have this feature, but only on one eye. Now this one is have two things. This one, when this bar line up is here, this lamp they don't have any. It's neutral position. It won't go to the nearsighted or farsighted. When you move to here, it become glasses for the farsighted people, for the senior people. You move to this side, the minor side is for the people with nearsighted. Like for me, I have a little bit like 1.5, so I need to move to here.
So here. I'm sorry to interrupt you, Dr. Zhang. So whenever I wear my glasses, sunglasses, glasses, this must be here.
Yeah.
Just
Yeah, because now your eye is already correct by your glasses, so you need to put it in the neutral position. The problem is if you didn't move it to neutral position, and then it's kind of you are wearing a glasses. When you can see clear, you have to adjust the microscope a lot. You still can see clear, but when you can see clear, your student he cannot see the same focus level of you. Yeah. So here, like for example, if my eye I have some nearsighted, if I put it here, and then I can adjust the microscope and can see clear, but then you cannot see clear. So I have to correct my eye first, put on the glasses first, because I don't wear glasses, so I need to adjust this one to make a glasses for me right away. And
so it's always better to wear glasses while using microscope.
Yeah, it's kind of, but if like your eye is totally normal, and then like some of the residents they don't wear glasses, and then they put it in here. I mean, this one is to correct the difference of two sides. Like, how many degree of your glasses?
2.5.
Yeah, 2.5. So in the textbook, it suggests like below 1.5, you can, if you feel wearing glasses is kind of preventing your eye can watch clear. Like sometimes the glasses is kind of too far and then blocking your eye from here. You want to remove your glasses and then use this one as a glasses. It need to be like less than 1.5. Because more than 1.5, when you come out to see, move out of the microscope, you cannot see the table clear. Especially when you try to look for a needle or something, you cannot see clear. At 1.5, you still barely can see the instruments. More than that, it's hard. So this is the eyepiece. Make sure you can see clear. And another thing of this secret way of using this one is when you go to the OR and the teacher is doing microsurgery, that means he can see clear. And then you sit down, you adjust everything to match your eye, but you cannot see clear. But you don't want to interrupt your teacher because he is doing well. So in that situation, you can just turn this one to either side, adjust diopter to correct the difference of between with your teacher. So that's even more important at that situation. That may be caused by the microscope. There may be something wrong, or your teacher he didn't put it into the neutral position or didn't correct the his nearsighted or farsighted at that moment. So this one is very helpful. Yeah, you can try. Yeah, not the outside. Outside, just turning the lens in here. That's the.
Excuse me, what does this do? This part?
Oh, this is just turning the lens. Like you can take the whole piece lens out from here.
Oh, okay.
Yeah, that's the whole piece. But turning this one, you change the lens inside. Okay. Now you can sit down. Yeah.
I can't see anything now, so I must adjust
Yeah,
it.
adjust it. If this chair too high, you can use this chair.
Actually,
Yeah,
I can lower this.
Probably this is the lowest.
No, I'm fine.
Okay. Okay. Yeah, because we want our body can stay in a good posture. So like sitting straight, and then our foot can put on the ground, put on the floor.
This is not good, Dr. Zeng. I only see now one circle now.
So you adjust in the pupil distance.
So let me adjust it. This is now I see only one circle. Now I only see
one eye.
Circle.
One eye or one circle.
One circle.
One circle. So okay.
Okay, I think it's okay.
Okay. So here, remember last time I made to like here, how far our eye should stay away from here. So now you can stand up. Light, this light kind of catch and then to here and then project to our eyes. So see, this is the sharpest spot. When we're getting further, it becomes blur. When we're getting go closer, it's also getting bigger and blur. So our eyes should stay away like this distance. This way can allow all the lights from here enter our pupil. So this is about like 2 centimeters. So our eyes stay here, and then sometimes we move. If we're getting higher, we move a little closer and move. So it's not completely touch on the here as close as we can. That's the mistake I made. At the beginning, I try to see clear and put my eye kind of leaning on the lens and making it a circle on my eye. But later, I know that's wrong. That's not good. Okay, now you can see that. Now I want you to do okay, now we do a test. Okay, now you look into the stay away and look into the lens. You can see 2 light spots in the lens, right?
Yes.
And then now I want you to move your head slowly close, and then your eyes keep looking at that 2 light spot and tell me what happened.
They start to intertwine.
Yeah.
And then now only one circle.
Yeah. So at the beginning we see 2 light spots, and then slowly it become merge and then become one. Yeah. So this is the method I help the student to understand 2 eyes see 1 circle. Now you can see the process of 1 circle, because at the beginning some of the students they don't. Oh, what's 1 circle? They didn't make sense until I use this method. That's it. So sometimes we may not, if the microscope is not good, you may see like this one a little bit overlap but not completely overlap, right? And then you understand that what happened and why, and then you can adjust it yourself or adjust the microscope. Yeah.
Thank you. I don't know this method.
Yeah, I just haven't constantly find this method. Hold down the foot control. Now on your left foot is the zoom, the right foot is the focus. Yeah, it's like the pedal is like a seesaw.
Oh, okay.
Use your toe to press this side. Use your heel to press this side. It's easier. Yeah.
Okay.
Yeah. Okay. Now here, look at the lens here. Yeah. Look at the number here. Outside 10 times. So the eyepiece has 10 times. Look at here. So it's between 0.4 to 0.5.
0.45, I think.
Yeah. So you step the zoom. Yeah. Now it's 0.5. So now the magnification is 10 times 0.5. Now it's 5 times magnification.
Oh yes.
Yeah, you step on it all the way.
Now,
all the way.
Now it's 10.
Yeah, keep going.
Oh, sorry, I thought
Yeah.
it's 1.
Yeah, keep going all the way to the end.
Okay.
You just step on it. Yeah. Yeah, don't stop. Just don't miss it.
Sorry,
Yeah. So now it's 24 times.
Okay.
So 24 times is really small view and hard to survey. You can see this one it's also becomes smaller.
Okay. I didn't pay attention here, but
yeah. Okay, you then step on the zoom. Zoom out all the way.
That's the end, I think.
Yeah. Zoom out all the way.
Focus?
No, the zoom. Just step on the other side, other end. Go to 4. Go back to 0.4.
So
Use your heel to step on this one.
Okay. So
So this is about a microscope, and now we're going under the microscope and see. Now to set up the microscope, the first step, we want the microscope, everything go back to the neutral position, like the eyepiece, and match our eye, and then focus. Here, we want to put the focus back to the middle. So this, now I step on the focus. So this focus is for the file adjusted. Like when this marker in here, then it can go up and down. If it's all the way here and then we cannot go down anymore, that's not good. In a microscope, during the surgery, we want it can go up and down, right? So we put it in the middle. In a microscope in the OR, it's not like this. This microscope is move the whole piece up and down. The new microscope in the OR, they has a ultrasound motor inside the lens. So when we step on the focus or press on the focus, the motor changing the lens inside. It's not moving the microscope. So this one is kind of moving the whole piece. Didn't move the lens inside. So that's a little bit different. And in an OR microscope, if you don't see this indicator, there's two different things I can see. One is like a Leica microscope. They have a two laser spot, red spot. If you go to the OR, you may see that two spot is the indicator. When they merge to one, that means it's the microscope is on focus. If it's still separated to two, that's not on focus. And in some microscope, it's the same way. Like we step on the focus and you just see clear, but you don't have that indicator. Usually, I wanted to put it into the middle. Is I press the focus going up all the way, and then I press the focus going down and start counting like 1, 2, 3, 4, 5, 6, and it stop. And then I press it going back to 1, 2, 3. That's kind of it's in the middle.
Okay, but sorry, I couldn't fully understand what happens when the focus goes up and down.
When it goes up and down, at the beginning to set up the microscope, we want it go to the middle.
So this is now in middle.
Now it's in the middle. But some of the microscope you don't see this one.
Okay.
They don't have this one. This is old style. Some of them you won't able to see that. Like in the OR microscope, there's a LED indicator there, but sometimes they don't have that. They can cancel that to save some cost of the microscope.
So how do we adjust it? How can we adjust when the microscopes don't have this sign?
Yeah, so my way is kind of like I go all the way up to top to the focus on the top. There's two buttons. I go this one going up all the way, and then I press the button, focus button going down, and then I starting to count 1, 2, 3, 4, 5, 6 until it's reached the end of the other way focus.
Okay.
And then if I counted 6 or 8, that means if I counting back to 3, that's almost in the middle. Or I counting back to 4, that's almost in the middle.
Oh,
and then I press going back again, and then I started counting 1, 2, 3, 4. It's kind of when it's moving and then it stop at 3, it's almost in the middle. So I set up the microscope has the capacity of it going up and down instead of really very close to the one end, and then when we want to adjust, we cannot adjust the focus anymore, and then we have to move the whole microscope. So for the rough focus at the beginning, we move the whole microscope like that. But during the microsurgery, when we just want to adjust a little bit, we don't want to move this one. Okay, we want to use the fine control, like use the foot control of the button to use the internal motor to change the lens, so we can see a little bit, adjust a little bit when you cannot, when like we walk on the nerve or walk on the artery, there's a little bit distance between them. So we don't want to move the microscope. Okay, now, yeah. Can you see clear now? Now we can move the whole microscope to for a right focus.
Yes, I can see very clearly now.
Okay, good. Yeah. So I'll give you a paper. So we write down something.
Okay. You're right. It's really right. Just sit so.
Yeah.
Because I have to leave when I eat here.
Yeah. Because this chair cannot go too low, and then this chair cannot go too high, so we have two set of chair. That's the pen. Now we move to the microscope. Okay, now I want you to. Now it's on four time magnification, right?
Mm-hmm.
4, right?
Yes.
Yeah. So how many centimeter can you see? Can we see here?
How many centimeters?
Yeah.
I can see from 1 to 5.
Okay. Yeah. So you write down, and you can write down 4 time magnification. We can see 5 centimeter. It's kind of the field of the view is 5 centimeter. Oh, yeah. I mean from the diameter of the lens, diameter of the field.
Oh, okay. I think it's almost 6 centimeters.
Okay. Yeah. So
Oh, 6.
yes, 6.
I mean, like 5.9 centimeters, but we can say
Yeah.
approximately 6 centimeters.
Yeah. So look at the depths. How many milliliter can you see clear? I mean
Like
clear.
4.5.
4.5. Now here is a little bit not so clear. We want a very clear vision. How far? That's the depth of the view.
Okay, it's 4.5.
4.5 here.
Mm-hmm.
Okay.
Yes.
Yeah.
Depth.
Okay, now let's zoom in the microscope. Yeah, we step on the zoom in.
Okay.
Yeah. Yeah, look at the microscope.
Should I continue?
Yeah, keep going all the way to the. Okay, now
It's
our focus, right?
Yes.
Okay, now move the microscope because now it's our focus a lot. So move the microscope and go to right focus. Yeah. Oh, you still put on your glasses.
Here?
Huh?
This step, the focus.
Oh, here.
Oh, okay.
Yeah, move the microscope.
I cannot see it really.
Okay, now we go move the microscope. Yeah, you move the microscope.
Okay.
Yeah, think about just a toy. Okay, it's yeah.
I must move by holding here.
Yeah, kind of. Yeah, you can use 2 hands.
I feel.
Okay, now it's clear now. Yeah, and then
Sorry, but I cannot see.
yeah, because you remove your glasses.
Yes. Sorry. Now.
We move the microscope for a right focus, and then we use the foot control to do a minor adjust to go to a very quick focus.
Okay, I think now we can use our foot.
Yeah, yeah.
Right. No.
Yeah. Yeah, very good. Yeah, is that very good now?
Yes, I can see clearly.
Okay, now tell me how many centimeter can we see? I mean, millimeter is also one space is 1 millimeter.
I can see.
Here's one centimeter, a 10 millimeter. It's kind of like from
It's
here.
around 9 millimeter, I think.
Okay. Now, so you write down. Now it's 24 times. 9 millimeter. Yeah, and then let's take a look at the depth. How many millimeter can we see clear?
I can see.
Very clear, because when it's getting blurred, we cannot do microsurvey, right?
So I should count the blurry ones?
Yeah, no blurry one.
Then it's 2 millimeter.
Okay, 2 millimeter. Okay, now I want you to think about imagine there's a space. I have 4 times. This space is like 6 centimeter wide and 4 millimeter high. This space is we can see clear and can do microsurgery. Out of that we cannot do microsurgery because we cannot see clear. And then when it goes to 24 times, that space become like this big, like a nail's big, 1 centimeter, 9 millimeter, and then 2 millimeter high. Think about that's the space we can do microsurgery. Like if we out of 2 millimeter, we cannot see clear. If we out of 9 centimeter, 9 millimeter, it's out of the field, we cannot see clear. So doing microsurgery in this space is very comfortable and easy. When it goes to this magnification, it's really hard. It requires our hand has very good skill and good control, and then in that level, it's very hard. Our hand is getting tired very quickly.
So Dr. Zeng, are you using this 24 times magnification maybe in tiniest vessels?
Yeah, yeah.
And
so
for the bigger ones.
Yeah, so when we have to go higher power, we have to go to higher power. So the principle is go to the lowest power, we can do microsurgery. We want to see bigger view instead of want to see the things bigger. It's hard when it in the lower power we can do microsurgery, just go to there. Like if we can do at 6 times magnification, don't go to 16.
Like the map, actually. There are also some proportions while using maps.
Yeah.
In, for example, 401, you can see larger areas.
Yeah.
But less detail.
Yeah.
As it gets bigger, the area you'll see gets smaller but more detail.
Yeah, yeah. So microsurgery is when go to the appropriate power, you can see enough detail and don't need to guess, but don't go to higher. Use the lower power to do microsurgery. Okay, now zoom out the microscope again. Zoom out to 4. Yeah, all the way to 4. Yeah. Keep putting the microscope. Yeah. Now it's 4. Okay, now zoom in the microscope again.
So 24?
Yeah, 24. Watch the microscope.
Oh, okay.
Yeah, so Ipek, this time when we zoom in and zoom out, we can see clear.
It's more detail.
No matter we zoom in and zoom out, right? Remember the first time when we zoom in the microscope to 24 times, it's out of focus.
Okay.
We have to reset up the microscope, right?
Yes.
What changed? What makes the difference?
The position of the microscope?
Yeah, yeah. So we want the microscope can stay in focus no matter we zoom in and zoom out, right? Instead of we zoom in and then lose focus, and then we have to move the microscope again.
I first made the raw focus with my hands and from here, and then for finer focus. I use my heel,
Yeah.
My feet.
Yeah.
And after we found the ideal focus,
Yeah.
no matter the proportion is, we always see detailed and clear
Yeah.
vision. Okay.
Yeah. So at the beginning, when we can see it at a 4-time magnification, why it lose focus when we go to 24?
Can you please ask again?
I mean, at the beginning, remember when we can see it at 4 times magnification, and then we zoom into 24, and then the eye of the microscope lose the focus. Remember?
I think it's because when you 24 magnification, more detailed, more hard to see.
Yeah. So that's I want to talk about the depth. Remember the depth is like that significant difference of the depth. So at 4 times, the depth is like this big, 4 centimeter, 4.5 centimeter, right? So when it's on 4 times, so this ruler maybe in here, and here, we can see the ruler, right?
Oh, yes.
Yeah, when we zoom into the 24 times, the depth becomes 2 meridian. If the ruler is not within this level, we will lose focus.
We will see
Yeah.
we will have blurry vision.
Yeah, so most of the time when we can see clear at 4 times, when we zoom into all the way to 24 times, we will lose focus. And then when we set up the microscope at 24 times, and when we can see the ruler clear, this ruler is in here, right?
Okay, so our focus, I mean, the position of our microscope now is in such height that it includes both areas. I mean, they're common areas.
Yeah.
Okay.
Yeah. So when we focus on here, and then when we zoom out, the depth become bigger, and then the bigger depth will definitely including this small depth inside.
I think I understood.
Yeah.
The only clear area that we can see in 24 magnification is this area, but for example, if we are using 4 magnification, we can see clear both here.
Yeah, bigger than here. Yeah, it become a larger depth. So this is the depth, and this one suggests we should set up the microscope in a higher power. Higher power, higher magnification at the beginning. Like if we do a finger representation, we may use 6 on the artery, maybe 8 on the vein, maybe 4 on the nerve. So we 4 times lie in the nerve. So we want to set up the microscope in a higher power. So like maybe 10 times or 16 times set up the microscope here, and then we go to here, do the way, and go to here, go to the nerve, and then go to here to do that. We can stay, the microscope can stay focused. Instead of we go to the way for 8, and then we need to move the microscope. We go to 6, and then we move the microscope. We go to 4, move the microscope.
We want to set up the microscope according to the highest magnification that we will use during the surgery.
Yeah.
That's why I made the last focus with while we are checking the 24 magnification.
Yeah.
Okay,
yeah, and then we move like from 4 to 24. It's all staying focused. Yeah, so that's a terminology is kind of the focal. Yeah, should be like that. It's kind of the focus always in the middle part, in the state in there. There are shared focus points, so when we zoom in and zoom out, it stay in there. It's that center. So I learned this. I know this way. I know this method, but I don't know there's this terminology. The microscope company told me the terminology of this thing. So when you go to the OR, set up the microscope in a higher power, we may not need to go to all the way 24. Like for the DIEP, we may use 6 and 8, 6 or 8 or 4. So we may just go to like 16 or something, because we won't go up to like 30. So some of the microscope now in the OR, they can go to 30. But we don't have to go all the way to 30, because DIP we never go higher than 10. Like for the finger, we may go, distal finger, we may go to like 16 something or 10. So we can set up the microscope like at 20 or something, so we don't have to move the microscope. That can make the surgery, your surgery, more efficient.
I see. So, I mean, by this way, we can also prevent the time loss, because we will adjust according to the highest one.
Yeah.
So we won't have to do it over and over again.
Yeah.
In case we need to use higher magnification.
Yeah.
Because we already set up in the beginning.
Yeah.
According to highest magnification.
Yeah. That's why we're doing this. And that's the depth, how we use the depth in the microscope in a real practice. Yeah. Okay, now let's look at the instrument. So that's the microscope. Mostly now I believe you can understand. When you sit there, you know what to do. Eye piece here and there. And then the microscope. Any question about the microscope?
No. I just, in the beginning, how did you, while measuring the depth, how did you place it? Vertical or maybe more leaned like this?
Oh, it doesn't matter. Just I made this one just to demonstrate how much depth we can see.
Okay.
Actually, the depth is kind of, we can see here clear, and on the other side, beyond there, we can see almost the same on the other side.
Thank you.
Yeah. And then now we talk about the instrument. So microsurgery, there's only 4 instruments. Now you can see a lot. That's a lot also. So there's only 4 instruments: needle holder, scissor, forceps, and dilator. So that's only 4 instruments. That's good for most of the microsurgery.
Needle holder, scissor,
Yeah,
forceps,
and you can see this one is a little bit different. Look at the tip. Yeah, we can look at the dilator. Dilator. Dilator is to make the vessel bigger. Dilator. So this is the needle holder. So you tell me what's the difference?
This one's edge sharper.
Yeah.
This one's total length is bigger, longer than the other ones.
Yeah.
And I think this tip of it is horizontal. I mean, these are.
The curve
Yes,
is
the
a little
curve.
bit.
These are vertical. The last part of them, but this is horizontal. Yeah, I think like this.
Yeah, nice. So the tip is the most different. So this sharper tip. So this one is the tip is rainbow instrument. You can see the tip is 0.1. See, 0.1 millimeter.
Yes.
Yeah. So 0.1 millimeter is super fine needle holder. So this one is the regular. So when you see this is a regular needle holder for the plastic surgery. When it's that regular, the tip is 0.3 millimeter. And this ruler has maybe the size of the diameter. So when you go to here, you can see. See that? 0.3 the tip.
Yes. Okay.
Yeah.
So the ones we use in plastic surgery practice, these ones.
Yeah, plastic surgery. And most of that is 0.3. Now this one is a little even bigger. This one it's about 0.4. Yeah, see that? 0.4.
Yes.
Yeah, the bigger one is to holding a larger needle. Like when we use this one, 0.1, we only use to pick up the 11O, 11O or 12O. Don't use this needle holder to holding 8O or 9O because you damage the needle tip. And it's not strong enough to holding that big needle to pierce the tip also. This one is used to holding the 10O or 9O. And this one is stronger, used to holding the AO. The smaller, this bigger needle holder, it will occupy part of the length of the needle. So we don't want to use this big needle holder to pick up the small needle because we kind of just will occupy like this is the needle, like 11O needle. If we holding the big using the big needle holder, it will kind of occupy part of the length of the needle. So it can making it not enough long length on the other side. Yeah.
So we must use the thinner one.
Yeah, we may use the smaller one to hold the needle. And you can see there's difference is the handle. So this is the round handle. Handle is round handle.
Round handle, yes.
This is the flat handle. So the flat handle you can hold it more stable. The round handle, the good thing is you can locate it easier. Yeah, you can locate it easier. And also here's a lock. This don't have a lock. You can go under the microscope and see how it locks. Yeah, you try it.
Okay. Yes, I see.
Yeah, so there's a hook when you reach with the hook and then it lock. Then when you push beyond the hook and then it unlock.
Okay.
So it's a very good design there.
Nicely designed.
Yeah, so I tell you some of the information here. Right here.
SNT C14.
Yeah, so SNT is the company. C, what's the C mean? The C means curve. The needle holders, there's a curved needle holder. So some of the needle holder, they are straight.
Yes.
Yeah, curved needle holder is more common use. And here's a 14.
Degree of it. The degree of it.
What?
Degree of the curve.
Yeah, they some of the needle holder, it's a straight needle holder. Let me see. Straight needle holder. Okay, we don't have straight needle holder, right? Most of the time we don't use the straight needle holder. Needle holder, we use it sometimes we holding like this way, sometimes we holding like this way. It depends. Straight needle holder, one of my teacher, he used the straight needle holder. His idea is the needle holder is straight, so I don't need to change the needle holder. It's always straight.
Can you please say again?
Yeah, like sometimes if we want to pick up something, we holding the needle holder like this way, so it's easier to pick up something. When we holding the needle, most of the time we holding the needle holder like this way. And then my teacher, his idea is the straight needle holder, it's always straight, so he don't need to flip the needle holder to change.
Okay, but we change this.
Yeah, so yeah, the curved needle holder, it's a little bit more convenient when you're holding the needle to do using the needle is very convenient. Okay, I want you to read here. So here's the RC
0.1.
Yeah. So the R is the round handle, curved needle holder, 0.1 millimeter tip. And here's the 15 centimeter long L. Yeah, that's the needle holder. Now this is the scissor. Yeah. If you want, you can take a picture of the needle holder. You may not see all the needle holder.
Wrong picture.
Yeah.
Okay. That's it.
So this is the scissor. Yeah. What's the difference? You see?
Again, these ones have straight handling, and these ones have round handling. Again, the sharpness of the tips are different, and also it's the longest one in length.
Yeah.
Also, the length of the tips are also different.
Yeah.
For example, these have longer. This is longer.
Yeah. So this is the blade size. The blade size is the instrument length. So this set is the blade length is 2 centimeter. 2 centimeter. From here to here is 2 centimeter. Blade length is 2 centimeter. So this is the standard for the plastic surgery, like DIP something. This one is like 1.5. This is for the hand surgery. Most of the smaller for the hand surgery. And when it's going smaller, that's for supermicro surgery. Supermicro surgery, the blade size is about 1 or 1.2, like that. And the blade is also smaller and finer. Yeah, and then you can see this is the curved scissor. This is a straight scissor. So there's a special name. I look at here. So S&T is company. So it's SDC.
So
yeah.
Straight.
Yeah. So scissor, the first letter is scissor. And then this is a straight, this curve. The middle, A, it means stand for adventitia. This D stand for dissection. Dissection.
Okay.
Yeah. When we think about when we're doing a regular surgery, we use a curved scissor to dissect the vessel out or dissect the tendon or dissect the muscle. So that's the same thing. A curved scissor, mostly we use curved scissor to dissect the vessel. So that's why we name it as dissection. Yeah, and then 15 is the length is 15 centimeter long. And this A is the adventitia. Adventitia, before we do this is the vessel.
The layers of the vessel. No.
Yeah, there's adventitia. Yeah, it's one layer outside. That's a very loose connecting tissue outside. So sometimes when in the trauma, it getting loose and handle outside of the vessel. So we need to clean this adventitia to prevent it going into the lumen. We don't want this adventitia going into the lumen because this is the tissue outside. It's a coagulation factor 3. It's a very strong coagulation factor. Once it go into the lumen, show up in the lumen, we start a coagulation cascade, and then we develop a thrombosis there. So we want to remove it like 2-3 millimeter away from here. So when we're stitching in here, it won't go into the lumen. So when we're doing the adventitia, at the textbook, we pull the adventitia out by pulling it, and then we cut like this way. And then I think that's the reason they name it as a adventitia scissor of the straight scissor. Cut it this way. But most of the time when we're doing the linear adventitious, we still use a curved scissor. This straight scissor, most of the time, we just using it to make a straight cut, or make a straight cut like this, we spatulate the vessel. When we spatulate the vessel, we create a bigger size of this pen.
So Dr. Zeng, can we use this one both for adventitious and then to have a clear cut?
Yeah, it depends. This one is more convenient. This one is good for a straight cut. Yeah. Yeah, so that's the, and let's talk about this longer scissor. So, yeah.
STC 18, right 8.
Yeah, so what's that? What's that mean?
Scissor.
Yeah, scissor.
Dissection.
Dissection.
C, it means curve.
Yeah.
80 means length of the scissor.
Yeah.
For right hand.
Wrong handle.
Right handle, yes.
Yeah.
And I don't know.
Yeah, the A is the diameter of the handle, is A millimeter. Yeah. So that's a global standard when we talk about the long handle instrument. Most of that for the plastic surgery is A millimeter. Some of the ophthalmic needle holder, the round handle, they go to smaller, like A6 millimeter, a little bit smaller. But most of that is the round handle is A. Every country makes like that way. Okay, that's the scissor. Any question about the scissor?
No, thank you.
And you also can take a picture of that. Okay, then the third instrument is the forceps. So the forceps, what do you see? These two is the same.
Again, round handling, round, and these are straight. The edge of this one is curved, I can say it's directed. Yeah. And these ones have straight edges. Yeah. And how can I say, the edge of this one is horizontal to the ground, but this one goes vertical. And also the length of the edge is also different. Yeah, the length is different. This is, for example, longer than this one. Yeah. And the total length of the forceps are also different. Yeah, good, nice. Yeah, so long handle, flat handle, long needle holder, angle tip, and yeah, so this the same thing that the long handle you can turn and moving it easier. The flat handle is more stable, you can holding it feeling better. So when you like Dr. Paul, he like the flat handle, and I like the round handle. At the beginning, I thought it's the personal preference, and I later I realized it's because the surgery we do differently. Dr. Paul, he do a lot of DIEP flap, and DIEP is a big piece of fat tissue. And the glove is always greasy after they handling a lot of fat tissue. It's like deep inferior gastric DIEP. And when the glove is very slippy and handling a long handle instrument is not convenient to do, not good. And I was a hand surgeon. Our hand usually is just a bloody glove. It's not as slippy as the DIEP surgeon's glove. So I like the long handle so I can turn the needle holder, turn it easier. Instead of when I'm using a flat handle instrument, I cannot turn too much. I have to turn my hand. It's harder. Yeah, it's harder. So like here, I can just turn the needle holder instead of I have to turn my hand to adjust the direction. This allows to make finer movements. Yeah. And then another thing is most important is the tip. Like look at the tip. I was just going to say this. For example, once I think this one is sharper than this one. Yeah, now you can go to the microscope.
You can see
The
this
colored
wrinkle.
one,
Yeah,
it's sharper.
yeah. This one is the 0.3. It's a regular instrument. I look at here. FJFAL3. This 3 is 0.3. The tip is 0.3 millimeter. That's the regular one. J is the jeweler. At the beginning, microsurgery, we don't have instrument. So we follow the forceps from the jeweler company, jeweler store, like diamond store or something. They put the diamond on the necklace or something. So that's why they name it as jeweler forceps. Jeweler forceps, this A is angle because the tip has an angle, right? And this L is the long forceps. This one is the jeweler forceps. 5 is the 5-inch. The forceps is 5-inch long. And this 0.1 tip, the tip is 0.1 millimeter. This one is already, yeah. This is jeweler forceps 5-inch long. They didn't write it 0.3. That's kind of big. It's already a 0.3, so they just skip that. You can see the difference, right?
Because the 3 millimeters is standard one.
Yeah, standard one, so sometimes they didn't write it there. Now you can see the 0.3. And this rainbow instrument, you can see 0.05.
The thinnest one.
Yeah,
The
so this,
shortest one.
yeah, so the L is 12 centimeter long. 0.05. I think about 0.05 is kind of 1/6 of this 0.3, right?
It's like
Way smaller than this.
6
Yeah,
times.
this is, yeah. I think about if when we're doing a simple microsurgery, the number of the vessel is like 0.3, 0.5. If we still use this 0.3 millimeter forceps, it's hard to do microsurgery on that so small vessel. That's why when you go to super microsurgery, it's better to have this super fine instruments. And this instrument, like sometimes we have our instrument on the table to adjust it. But when we use this super fine instrument, they told us don't tap your needle holder on the table, because once you tap on here, you will lose that 0.05 tip. And the tip is the money is only paid for the tip. Once the tip damaged, and then it's not as fine.
It's useless.
Yeah, it's useless. It's hard to repair it, go back to that normal, the 0.5 tip by our hands. Yeah. Okay, that's the forceps. Yeah, you can go closer so you can see the number on it. Next time, so you can tell your student.
I like these colors.
Yeah, I like this. And this is the dilator. So the dilator, let's go under the microscope, you will see the difference of what's that. Now you can see the dilator is, the tip is smooth, right?
Yes.
Very smooth and shiny. And then look at the tip. This one is designed only touch the tip. So this one can pick up things very accurately by the tip. This one is can design touch by the first segment. So we can put inside the lumen of the vessel and then open it and then dilate the vessel.
But I briefly understand why don't we use this one to dilate the lumen of the vessel.
Because this one is too sharp. If we put into the lumen, sometimes we damage the internal, damage the vessel inside. So if there's not necessary, never put an instrument inside the lumen. And this one is designed a little bit smooth on the side. So when we're handling the suture, doing the anastomosis, we would like, most of the time we use a dilator to doing the micro anastomosis. And then you can see this one is smaller. This one is the 0.3, regular one. This is the 0.1.
Can you please show them again? I missed it, sorry. Show the tips of it.
Yeah, you can see this one is fine,
Yes.
right?
Yes.
Yeah. So D is dilator. D is dilator. This is ASSI company, this STMT company. Phi is the 5-inch, A is angle, because this is angle. Some of the diameter is straight, but the angle one is easier because the vessel is always laying flat here. And then when we put into the lumen, we want this angle diameter. We don't want a straight needle holder, or we don't want to hold the metal for supply this way. This way can has lower, we can put into the lumen.
So the angled ones are more advantageous.
Yeah.
In this.
Yeah. Yeah. So this is 0.1. This one didn't have a 0.3, they just skip it because that's the standard one, 0.3. Yeah. So that's the dilated. So mostly that's all 4 instruments used in the microsurgery. And this is the bipolar. Bipolar for the microsurgery. The tip is like the regular, like the 0.3. You can see some bipolar for in the general surgery or brain surgery, they're bigger one. So this one is for the microsurgery bipolar. This is the clamp. So usually we put the clamp like 1 centimeter away, and then we put it there. When we cut the vessel, we can move it a little bit away, so make the vessel has small gap in between. Small gap in between. We don't want the vessel really close. If the vessel very close, we cannot see the lumen. So we want the vessel a little bit, stay a little bit away, like one third of the diameter of the vessel, so we can see the lumen, and there's not much tension when doing an anastomosis. Okay, yeah, that's the micro instrument. And here's one thing very important about the suture. So you can write down here. Like micro suture for plastic surgery, we use 8O, 9O, 10O, 11O, 12O.
8 to 10.
Yeah, 8O, 9O. Yeah.
For plastic surgery.
Yeah. Plastic and hand. 10, 11, and 12.
Oh, so.
So usually when a vessel bigger than 3 milliliter, we use AO. Yeah, between 1 to 2, we use 2 to 3. 2 to 3, we use 9O. When it goes to 1 to 2 milliliter, we use 10O. 1 to 2. When it below 1 milliliter, we use 11O. Below 1 milliliter. When it goes to like half milliliter, if we have 12O, use 12O. Because now at that 0.5 milliliter, the size of the suture is the matters. Yeah.
So this is super microsurgery.
Yeah.
Up to which number we can classify as super microsurgery?
Super microsurgery now is considered as 0.8 to 0.3. 0.8. 0.8 milliliter. Super micro.
So it's one.
Super micro. Super micro. The vessel belong to super microsurgery. The size is from 0.8 to 0.3 milliliter. 0.8 or 0.3 to 0.8. That's super microsurgery. Yeah. When it like 0.8, we still can use 11O, but when it goes to 0.5, 12O is better. Right here, it's 11O, 9O, 10O, still 9O, AO. Also, here's another AO. Now, I'd like to tell you the information about that. Like O is kind of like this size of the suture, 0.4 metric, 0.4 metric. Yeah. So a metric is a pharmacology number unit. It's not about, it's hard to relate to like how many centimeter, how much inch about that. So it's kind of 0.4, 0.3.
So I think it's also written here maybe 30 centimeters. The total length of the
suture.
Suture.
Yeah.
30 centimeters.
Yeah. So this company all made 13 centimeters. Like this suture is 30 centimeters. 30 centimeters. But this one is 60 centimeter. So microsurgery, plastic surgery, hand we use like this is good. This one is for the cardiovascular surgery or transplant surgery. So they use long suture, they can run the big vessel. This one is a plastic surgery. Now this is a suture, and then here is the needle information. Needle information. And let's go to the 9O.
Dr. Zhang, what is the difference between this side and this side?
Yeah, good question. Yeah, so you can see there's different needle on the same suture. Like this is all 9O, right? So this needle is PV is blood vessel, so they all blood vessels. And this 100 is the diameter of the needle, thickness of the needle. It's 100 micron. This is 130 micron. This one is 100 micron. This one is 130 micron. And this one is 130. This one is 50 micron. Smaller, right? Half small of this one. And then go to here, 5.1 millimeter. That's the length of the needle. And this is the table 3/8 circumference. So microsurgery, we don't like the half circumference needle. In life, we stitch the tendon. Sometimes the tendon we use half circumference needle. Right? Also, this ophthalmic needle they use half circumference. Half circles. 2/3 is easier. 3/8 is easier for the vessel. So and then this is taper. Taper tip of the needle is kind of the round body. That's considered as a traumatic needle. But this one is spatulate. That's not. Yeah, the cut. This one is not very good for the vessel actually. But the company they just mix. The company just they mix all the needle and then make the suture, make a product. They like this one is not a good product for a microsurgery because the needle, this one is kind of very pierce the vessel. If you create not a round hole, this hole may be a leaking because some leaking there. So that's not a good one. And another thing is, like take a look at this AO suture. So this AO suture, the length of the needle is how much is the? How long is that?
3.8.
Yeah, 3.8. And what's this length?
5 millimeter.
Yeah, 5 millimeter. Think about the AO suture. We work on a 3 millimeter vessel. That's a big vessel. And if we use a needle so short, we cannot reach the. It's hard to do on a big vessel using a short needle. So this
short.
The needle is short. Yeah. So this one is a little bit longer than this one, right? So when we go to when the one of the lab they want me to do the vessel transplant on a monkey, the femoral artery. They asked us, what suture do you want? I said AO suture, and then they bought this suture, and I use this suture on the femoral artery, and then I realized the needle is too short. And I told them this suture is not good. And then I realized even the same AO suture, they have different needles. Because I use this needle, I have this one in the lab, but they buy this one. So I cannot use this one on a femoral artery because the needle, the length of the needle is not good. So I told them to buy this AO suture and then donate this suture to the teaching. Yeah. So when you are the first microsurgeon in your hospital, you need to know the right product. Like AO, this one is not good. Just go to this way. And then the NIO suture, NIO needle, we still go to a pretty big vessel. Like this vessel, big vessel, like comparing these two needle, this needle is 5.1, this needle is 3.8. So this one is not good. We prefer this one, right?
For bigger vessels.
Yeah. And this one is totally a wrong product. We should not buy this one at all, right? So we goes to like that way. And when it go to the 11.0, the 11.0, the suture is, the needle is 550 micron shorter. That's good, right? That's a good one. And when it goes to the 10.0, actually this 10.0 is not good also. This 10.0, the needle is short, but the needle is big, 130 micron. It's bigger than the 9.0 needle, right? When it goes to the smaller vessel, we want a needle also smaller, not so big, not so thick. So this one is also not very good. So the company, they just mix. I realize this. They just, oh, I have this suture, and then I have this needle, and then I mix them together to make everything.
There are different sized vessels,
Yeah.
so we need to change the suture according to the size of them.
Yeah, I mean, like we should not buy this. They should not produce this suture because it's not useful. They should not make this needle. Also, this is all acceptable but not very good. They should not make this needle. AO, the needle is so short, work on a big vessel. So this is the wrong product. So I want you, I'm telling you about this is when, if you are the first surgeon, microsurgeon, when a nurse asks you, Ipek, what suture do you like? You need to know what suture is the right one. Instead, tell them like, oh, buy an AO suture. And then they buy an AO suture that has a tiny needle. It's very hard to do on a big vessel, right? Yeah. So this is this is the 11, this is the 12. So this 12 is the smallest needle, 2 millimeter.
The length of it's 2
Yeah, yeah. This one, it's also 12, but the needle, this package is a little bit, because 2.5 millimeter. Yeah, but that's the smallest one. you see that needle?
Yes.
Yeah. So this is 12 and 2 millimeter needle. See, one space is 1 millimeter, so that's 2 millimeter. Yeah. So here, this one should be a 9-0 suture. Now you can see the difference of a 9-0 and a 12-0. See that?
Yes.
Yeah, so this one is the magnification of the magnetized. Okay. So this is 5.1 length needle, and this is 9-0 suture. Now you can see the difference. This is 2 millimeter. Okay. Now if we try to pick up this 4 needle holding like this way, it occupy a lot of length.
Yes.
Yeah. It's hard to pick up this tiny needle. It's a big needle holder. So that's why we it go to smaller.
Yeah. But when you hold the needle and how can I say, either the edge of the holder, it changes the direction. I mean, the needle.
Yeah,
moves.
that's the problem. When it goes to the round body needle, making it a little bit hard to holding the needle, a little bit twist. Yeah, that's the problem.
It's still smooth, that's what I was trying to say.
Yeah. Okay, you try to pick up that 12-0.
Oh, I'm sorry, but just
No problem. That
I'm
happens.
sorry.
Yeah, that happens. Yeah. So remember when to pick up the needle,
Yes.
the better way is to holding the suture, dangling the needle.
Yes.
Yeah. Now we dangling the needle, and then pick up the needle like that.
This goes out of this. So,
Yeah. Put it back here. You see. Oh, yeah. This is a special needle holder. See, that's a needle holder and scissor. Yeah. So I bought this one is specific for kidney transplant animal surgery, because in that animal surgery I don't have the assistant. I have to do it by myself. And the protocol require me to finish the kidney transplant in 30 minutes. The ischemic time is 30 minutes.
so the vascularization causes
Damage.
free radical
Yeah. Yeah. Yeah, you're good.
Oxygen radicals, yes. Actually, the problem in here, it's not the how can I say, prevention of blood supply. I mean, of course, it's a problem, but when the length, if it exceeds 25 minutes, the revascularization, the reoxygenation causes the release of free oxygen radicals to release, so it damages the kidney transplant.
Yeah, yeah. So in the animal surgery also we want the warm ischemic time less than 30 minutes. But by one person it's really hard. Like even doing this, I set up it very good. When I pick up the needle holder and finish one stitch, I need to put it down. Then I pick up the scissor, and then I cut the suture, and then put down the scissor and pick up the needle holder and do it again. So there's always like 30 to 33 minutes. And then I know there's an instrument like this. And I thought with this needle holder and scissor, I don't need to put down it. I just cut the suture and then keep going. So I was able to finish the kidney transplant like 28 minutes, save me 5 minutes of time. So when you have to do it by one person, this one is helpful. But sometimes it's a problem. While you're still doing surgery, you cut the suture and then you lose the suture. So using this instrument, always close it while you're moving. Sometimes the suture get caught into there, you don't know, and then you try to pick up a needle, but the suture, you cut the suture in here. So when you're moving it, always close it.
Dr. Zhang, while moving the stitches, which one should we use, the forceps or the needle holder?
That's a very good question. So there's not doing loops. There's 4 methods. There's 4 methods. Okay, that's a good question to start after. Today I want you to kind of during the microsurgery, we understand how to do it, and then we should understand why we're doing that in that way. So release the tail first. Same thing. Release the suture first. So if you go direct, if the suture still on the inside the sponge, and then you stop there, and then we hold the suture, hold the needle, try to take it out. Sometimes the suture stuck in there, and then we pull the suture, and then the suture break from here. So we release everything. Only the needle still in there, and then we take the needle out. Okay, I come to the under the microscope. Right. First, there are 4 methods. So I will show you all 4 methods first. The first method is our treating method. So the treating, like we tie nuts, we want to tie a flat nut like this one, instead of like, if we start by holding the suture like this way, holding by the forceps, and then we tie a knot like this way, that's not good, right?
Yes.
And then we have to close our instrument.
Yes.
Right?
Yes.
And then we tie the second knot, the regular one. And then the third knot, in order to tie a square knot, we cannot go this way. Like this way, we tie a slip knot. We have to close the instrument again to tie a square knot.
So make it tight.
Yeah, yeah. So this is one of the method you may see in the OR. First knot, like that, and then close the instrument. Yeah, like that. Okay, use a scissor to cut it. Yeah, use a scissor to cut suture. Now as we holding the suture, we won't lose the needle. So the way is we holding the suture and then just pull it all the way back. And dangling the suture, catch the needle. And when we pick up the needle, if we holding the needle holder like this way, it's hard to pick up. So we turn the needle holder a little bit. That's the curve.
Just a bit.
Yeah.
Yeah.
So the second method is the treating method. So we tie the knot. Now the first knot we made loops on the forceps, right? Now you can see we just pull it left to right, and then the knot is a good knot. It's a flat good knot. We don't twist it. The knot is good. And then the second one, if we keep going, and then we like this way, and then we have to close the instrument. The second method I want our resident, the beginner, to do is, after we tie the first knot, we go back to pass the suture. and then we tie a second knot like that. So we pass the suture. So we don't need to close our instrument.
Okay.
Understand? Does
Yes.
it make sense? Like if we didn't pass the suture, we have to close the instrument. And then we pass the suture. We don't need to close the instrument. We pass the suture. And then we make loops on this hand, and then make loops on this hand. This method, the good thing is we train our left hand and right hand to tie knots. So this is the training method I use here. So I teach the Western to train their both of the hand to tie knots instead of
use both hands.
yeah, instead of just use one hand. Because sometimes in this direction you don't have space to pull it, and then you just pass the suture to use another hand. So you that's and then this method can improve your hand dexterity. And then after you're getting better, we practice the airborne method. Airborne method is that you control your short end. You control it, and you catch it, and you control it,
Can I do it
and then
again,
you shoot
please?
it, control it, and then you catch it, control it, and then you catch it. So this method, the good thing is the short end is always in the air. So we transport the short end in the air. That means we name it airborne suture method technique. So when you're getting, if in a very difficult situation, you don't want to lose, like sometimes we do airborne, we still lose the short end. If we're walking in a deep space, like walking in a chest cavity, and then your assistant is not very good, if you lose the short end, it's very hard to pick it up, and then you can use this method to catch both of the suture, pick it up like that way. So this way you always can have control of both of your long end and short end. You will never lose it. So you don't need to go to find the short end, or that's kind of looks slow. It looks slow, but it's more efficient because you don't have to go to find a short end. Now you can see it's hard to pick up the suture because this forceps is only touch at the tip, right? So it's better to use when we're doing the stitching. It's better to use a dilator because the dilator can touch the tip better. So that's the 4 method of tying knots. You can see different method in different teacher, different situation. But the principle, the idea is like at the beginning we use the basic method, pass the suture, so we train both our hand. And with that method, we don't need to think how to close our hand, because sometimes we think, oh, how to close it, it confused. And use that method, you have more fun, you're happy, because you don't need to struggle. It's good for a beginner. And that's not a bad method. We still use it in some difficult situation. And it can improve both our hand. And when it goes to the OR, if we're getting better, we don't pass the suture, we just go all the way. Sometimes we don't really close our instrument to tie a square knot. You know square knot, right? You know square knot, right?
Sorry?
Square knot.
What does that mean? I'm sorry.
Square knot. Have you practice the regular stitching? The regular stitching.
Regular. Yes.
Yeah, regular stitching, there's a concept of square knot. Square knot.
Yes, I now understand.
Yeah. So the first knot is that. The second knot should go to the opposite direction to.
Only one loop.
Yeah, like this one to cross it. But in the OR, you may see the teacher just go up and down instead of cross. Yes. They go up and down. instead of cross the suture. This way, and then this one they go up and down instead of cross it. The up and down is also good. So usually microsurgery, those 3 knots is good enough. If there's a tension, we tie the surgeon's knot at the beginning. If no tension, we tie a surgeon's just a 1 loop knot. That's good. Yeah. Okay. Now you try. You can try. Yeah, you can use the other instrument, whatever you want.
First, I will.
Yeah, pick up a little. Yeah, so today we focus on one method. Try, okay? Yeah, go to the middle a little bit so we can see in the microscope. Yeah. Yeah, stitch here. Yeah, so the microscope can see you. This camera can see your needle. Yeah, let go. Now it's good. Yeah, use your left hand all the way out. Okay, yeah, and then I keep watching the short end until it's good.
This is enough.
Yeah, yeah. 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 Yeah, so that's very long. Very long is not good. So we put down the needle.
Okay.
Put down the needle and then hold it a little bit. Like here, I want you to remember one thing is the long end should be 2.5 to 3 times of the short end.
Okay.
That's a good length to make even 1 loop or 2 loop. It's almost here. Okay, pick up the suture. Yeah, use the dilator. Yeah, this the forceps. Use the dilator as a forceps. But this forceps is not very convenient to pick up the suture. Yeah,
I couldn't hold it.
Yeah. Use the tip of the forceps dilator to catch it. Yeah. You can hold it harder. Yeah, use 2.5 hands of the foot. Yeah, yeah, holding it harder. Yeah. Okay, good. Hold it this direction. Now that's not a fret now. The left is twist. Yeah, so you go this way. This is a good knot. If you pull this way, that's not. But if you pull this way, and the knot is twist.
Oh,
See?
yes.
So now I want you to know why we pull the knot like this way. Because like we pulling this way, it's follow the right direction of the suture. Like this one, then it's good. If we pulling like this way, see as we pulling harder, the knot will twist.
Yes.
Yeah, and you think about it. That's the suture edge, the vessel edge is inside the knot. If you twist the knot, that means that the vessel edge inside the knot is also twist.
Wait, the vessel itself will also twist.
Yeah, the vessel, like if you take a bite in here and take a bite on the other end. And then we including the suture inside here and then tie a knot. And then the knot twist, we twist this tissue inside. We twist, making here is not smooth. Edges of the vessel and the loose is not smooth. Then we increase the risk of thrombosis. That's why we want to even cross. We want to tie a knot like this is we name it is like a flat knot. The knot is flat instead of like this one is twist.
Okay.
So we want to tie a knot like this one. Okay. But for the first knot, yeah, you try. Yeah, holding this one. Yeah, yeah. Okay, yeah. Force up, needle holder. Yeah, so it's hard, right?
When you make it seems easy, but
yeah. Okay, now I want you to pass your suture.
sorry.
Okay. Pass your suture. Switch to your needle holder to hold this one.
Like this.
Yeah. No, not switch hand. Still use the right hand to hold the needle holder, but pick up the suture by the needle holder.
Okay.
Okay. Yeah. Now this instrument should be in between these two sutures. Like if this instrument here is out of two sutures, so this instrument loop on is always in between this the long end and short end. Okay. Yeah. We loop.
So this is.
Yeah. This. Yeah. Yeah.
Around here.
Yeah. Yeah. And then pick up one loop the skirt.
Okay.
Second now one loop the skirt. Okay.
Yeah.
Yeah. Yeah. Okay.
Yes.
Yeah. Nice. Okay.
Yes.
Yeah.
Thinking.
Yeah, keep going. Keep going.
I again hold with needle holder. This two.
Yeah, and then you can pass the suture. Yeah, the first method. Now we finish the knot and then switch to the forceps. Pick up the suture. Okay. Yeah. Keep going. Yeah. Nice. Okay. Keep going. Keep going. Now I want you to remember another thing is when you finish the suture, bring it back to in front of you.
Okay.
And then pass the suture to your needle holder. Okay. Okay. Keep going. Now here. Yeah, like here it's outside. Here is in between. Yeah. Okay. Yeah. Okay. Go back to in front of you. Don't just drop it. Bring it back to here. Use the needle holder. Okay. Bring it back to in front of you and take out the suture. Here. Forceps. Pass the suture to the forceps.
Like this.
Holding the suture by the forceps.
Oh, sorry.
Yeah. Yeah.
Okay, now.
Yeah.
Outside or inside?
Inside. In between. As a good flat now. Okay. Good. Keep going. Yeah. Yeah. Keep going. Yeah. Yeah. Pick up the suture, the tip of the suture. Okay. Keep going.
So.
Yeah.
Okay.
Yeah. Keep going.
Oh.
Continue. So you can point a needle holder, like holding the needle holder like this way. This, turn the needle holder. Yes.
Okay.
Yeah, this way when the needle holder pointing down, it's easier to catch the suture.
Okay. Oh, yes.
Okay. Okay, keep going. Yeah, bring it back to in front of you. Yeah. And then remember when go a little bit longer, like this one is a little bit short, go a little bit longer,
Like
3
this.
times, 2.5 and 3. Yeah. Yeah, now you're doing like one rest and
Thank you.
and
Thank
now
you.
I show you one more tip. Here is like when we make loops, we make loops here, and we can make loops right above of the short end. Like we go here and make loops, and then see we
Can
make
you
loops and then
please
pick it up. Like we make loops here, and then we need to travel to here. If we make loops right on above here, and we make loops and pick it up, then I here. We make loops right above here. So see,
Yes.
so we don't need to travel.
Yes.
And then if we travel right here, and then sometimes we lose the suture. If we just make loop here, see, that's why you see I am doing easier.
Yes.
Yeah, it's because like some of the small detail, like just I make loops here, and then you see how fast it is. If I doing like here and then I move, you can see the difference. Yeah. Okay, now you try. Yeah. Nice. Very good. Mm. You have a good hands. Yeah. Keep going until it's very short. Yeah.
One of the fibers just got into the loop.
Mm. Okay. Cut it and then we start a new one.
Should we open a new stitch or this is enough?
Oh yes, good enough. Yeah. Keep use this one until very short. But usually we can use it until like 5 millimeters.
Well,
Higher than us now.
yes, and a few days ago, no, last week, Dr. Gar makes such stitch that she used almost all stitch.
Yeah, yeah.
She used it very effectively.
Yeah. because the suture is expensive. One suture is about like $100.
Now it makes 4,000 Turkish liras.
Let's go to the middle, so the microscope can catch the stay inside of the microscope. This camera cannot catch the same as what we see. Now, when we pick up the needle, use the needle holder, because you see the forceps is so tiny tip.
Yes.
It's not designed to take the needle out. Yeah, when it's out, use the forceps you can use your left hand to take the needle out, hold the suture out.
Now it must be 3 times. So square stitch first.
Yeah, you can tie a surgeon's knot, make 2 loops for a surgeon's knot. Now the first knot, I want you to pay attention to the first knot. First knot, we can use the forceps to hold in a long suture, or we can use the needle holder to hold in a long suture. There's a difference.
Yes.
Now you try to use whatever you want to start.
Which one would you recommend?
Yeah, you try and then you will see what's the difference.
Okay.
Yeah.
So I will start with forceps.
Yeah. Yeah, slowly. Let's see how to tie a good knot. No, that's not a good one. Let's see how to cross the instrument to tie a good knot.
Like this?
No.
No.
Yeah.
What should I do?
You're still holding the suture. And you need to go this way.
This way?
This way. Go up. The forceps go up to here.
Like this?
Are you still holding like this way? To tie a good knot, you need to go this way. See?
Oh, yes, yes.
Yeah, it's right. Still holding that? Yeah.
Now, this has been a little bit long.
Yeah, this one is a little bit long. Yeah. Short. See, this knot is, yeah, this one is good. Yeah, so now I want to explain the first knot a little bit, and then because now it's 2 hours. Okay, you put 1 stitch again, and then I want you to see first knot is,
Okay.
yeah. Just now we use the forceps to hold in this long end, and then we have to struggle and think how to cross our instrument to tie a knot, right? Yeah.
First, need to have better.
Just here. Yeah. Yeah. Okay, now this time I want you to start by holding the suture by the needle holder. Yeah. Okay. Make it a little short. Okay. Yeah. Make 2 loops. slowly pull it. No, this time just pull it. Now you can see this knot is so convenient. You just pull it left to right.
Okay. Oh, yes.
And then up to now.
Okay.
Yeah, so, and then pass the suture for the second knot.
Like this.
Yeah, nice.
For my hands, here is a bit cold.
Mm.
My hands get cold, I'm sorry.
Yeah, yeah.
And they start to tremble.
Yeah, that's normal. The OR is also cold.
Yes.
Yeah, very cold. So, Ipek, comparing you starting holding the suture long end by a forceps or the needle holder, which method do you like?
I think both actually.
Yeah, both. Yeah, and then, but we can see if we started holding the long end by the needle holder, we just pull it to left to right, and then we don't have to close the instrument to tie a flat knot. That's the difference of we starting by needle holder or forceps. Yeah, yeah, just in a
Actually,
real.
this from left to right. Second one maybe actually felt more comfortable.
Yeah, yeah, like in the general practice, like if you're holding the needle holder, stitch it, and then we pull the suture out. We always use our right hand needle holder to make loops in the general practice. We won't switch hand to do that. So if we laterally, we would like to use this one to holding the suture and then make loops on the needle holder. That's because we translate the method from the regular stitching. But in the regular stitching, the first knot, we have to close the hand to tie a flat knot. But under the microscope, that's making it even harder. So that's why at the beginning, we would like to switch the suture to our needle holder first to avoid we have to close our hand. Yeah. Let me give you a quick suture and then I can explain a little bit more about the regular stitching. Okay, now you stitch here.
But I think some surgeons actually more experienced than generally, they hold it like this.
Yeah.
And
Yeah.
but given that I'm only a student, I will go with the rules.
Yeah.
I like this.
That's when you're getting better, you would like to hold the instrument like that. It's more, you can move it easier. That's the. Okay, what's that?
This simple. So big.
Yeah. Okay, just stitch on here and then, yeah,
Oh,
yeah.
oh.
Yeah. Holding the forceps like this way, holding a pen.
Oh, like a pencil.
Yeah. Usually we put down the forceps and use your finger to hold the suture. Yeah. Okay, now Ipek, right? It's really the same, right? When we pull the suture out, we put down the needle, and then we go to shorter and start tying knot under the microscope, right?
Can you say that? I'm sorry.
Right, we pull the suture out and put down the needle, and then go to 2.5 to 3 times on the short end.
Yes.
Same. So we translate the method from
reverse.
yeah.
So
Yeah.
first.
Yeah, in the regular stitching, we can hold them a little bit longer, that's for sure. Yeah. Yeah. Yeah, so cross this way. Yeah. Yeah. So this is also the same, like in a microsurgery. If we starting by the forceps holding the suture, the first knot, in order to tie a flat knot, we have to cross. Okay.
Okay, so
okay, next keep going. The second knot is kind of weak. Yeah. I see. Okay, now here. We put our needle holder in between these two sutures.
okay.
Instead of putting here outside and then make roots here and then go there. Right? So that's and in a microsurgery, we also put the instrument in between the two sutures. So it's also from here.
No, I actually theoretically I just focus for a moment first.
Pull evenly and then we square now.
Like this.
Yeah. Put this way. Yeah. Okay. That's the regular stitching. Okay. Yeah. One more.
Should I use this one?
This one is so we can use the finger in a regular stitching. Yeah. Regular stitching we can use we can holding the needle like yeah there you go yeah I okay keep going.
Okay.
Yeah, we can sometimes we just use finger to hold on the needle, but just be careful. Yeah, use the tip of the needle holder to catch it. Okay, one more stitch. Okay. Oh, now this time I want you to hand tie a knot. Okay. Yeah, hand tie, no instrument. Yeah. So be careful. Watch the needle. Okay. Yeah.
I was.
Yeah. Let me cut the needle. So now.
It's like this. First.
No. How to hand tie a knot? Have you practiced?
No, I just trying to figure out.
Oh.
This is the very first time I'm doing this.
Oh, no. This hand tie a knot is a different method. You haven't learned that.
Like,
have you
like shoelaces?
Have you practiced that?
No.
I mean,
Okay.
You haven't learned that. I think
I never done this.
So that's beyond. Yeah, that's double hand tie, not shoelace. It's a you haven't done that, that's fine. Okay, now holding two hands. First now is karate chop. You go here, and then you pull this one down and then catch the ball here. Yeah. No. Karate chop.
Sorry?
Karate.
Cutting. Oh, sorry, cutting.
So you're holding the two by two finger and then cut it. Go here.
Mhm.
Okay. Chop.
Chop.
Yeah, and this suture. This suture go in between here. Okay. Yeah, hold this suture. Put it here. Then this finger go down.
Like this.
That. Here.
Reach. Go. Yes.
Then you chop it and put it here. Put it here. Then your finger is holding like this. Then you go. Yeah, you're holding here.
I think yes, this.
Yeah. You go under. Yeah, still holding this one. Then go under. And then catch. Yeah, let's go here and catch this one. So this one is also in. Yeah. Yeah. Okay. Good. Try again. No, it doesn't matter. Don't look at here. Just keep going. No, watch the hand instead of the knot. You can pay attention. Look at the knot later. Yeah. Yeah.
I think this must be shorter.
So you are better in Michael now. Instead of that. Okay.
It's really confused me.
Yeah, that I will keep that for your teacher to teach you. Your medical school teacher to teach you that of that.
I don't understand. I'm sorry.
I will let this one for you, your teacher, your school teacher to teach you. That's not Michael now. Keep this one. Understanding information. This is the suture we use today.
Okay. Thank you.
Take a selfie. A second. Okay. Yeah, and now it's 2 hours and a half.
I'll practice.
And Michael survey, I think we have you have some basic knowledge to get started. Ready?
Yes.
Okay. Hello everyone. Yeah. Today it's Ipek, how long do you feel we practice?
It's 2 0.5 hours.
Yeah, but your feel,
I think it's been like just an hour.
yeah,
It passed so quickly.
yeah, yeah. It's kind of microsurgery. Every time we feel oh, actually, so you didn't feel it's 2 hours and a half. Like when I go to a karate class, that's 45 minutes. When it's almost half hour, and then I keep looking at the clock. Oh, there's still 15 minutes. So microsurgery 2 hours is just fine. Oh, it's 2 hours already. So actually, so that means you have fun. Even
I had
yeah, you
so much
enjoy
fun.
doing that. Yeah.
Now I feel more comfortable with doing microsurgical stitches.
Yeah, yeah.
And it turns out to be actually I'm better in microsurgical stitches. I just couldn't do the regular ones, so
Yeah.
I need to practice them.
Yeah, it's because you haven't practiced the
Yes.
general one. Like if you are the PGY1 student or PGY1 second year resident, you know much better of the micro of the regular stitching, and then we can relay more of both of this, and we can translate. And sometimes microsurgery we do it a little bit differently.
Yes.
Yeah.
I don't want to be too harsh on myself because the regular stitches it was my very first time
Yeah.
for doing it.
Yeah.
I will practice, I hope, in the future.
Yeah, you still have a lot of time.
And I would like to thank you again very much, Dr. Zeng, for this course. It's been really instructive and effective for me, and I said I had so much fun.
Yeah.
Thank you again.
Yeah, great. Okay, so see you guys. If you like our microsurgery teaching, just subscribe and share, and also please leave a comment here, and reach out to us because we go overseas to teach micro course. We go to Vietnam, Rwanda, South Africa, Egypt, Ethiopia. We bring everything, microscope, suture, and training material. If you want to learn microsurgery, if you want us to go to your hospital, your country to teach a micro course, reach out to us, so we may show up in your hospital.
This is the memory of today.
Yeah.
The stitch we used today.
Yeah, yeah. If you want to learn the small detail, yeah, please go over this video. We have a lot of small detail about the microsurgery instrument and sutures. Okay, bye and